ammonia, as well as increases energy and vasodilation. Ammonia buildup is with increasing proteins, and particularly if the quality of the proteins aren't as good. Citrulline helps reduce ammonia buildup. And sometimes you'll notice people, when you walk by them, they have this kind of ammonia smell from workout or even walking by them. The citrulline can help reduce ammonia production. And then, of course, once again, making sure your proteins are good quality proteins also decreases ammonia production. Arnica montana. This is something I know I personally take before my workouts, and then if I hurt myself, muscle strains, muscle fatigue. Arnica montana is also used by plastic surgeons, or recommended by plastic surgeons for their patients before they go into particularly plastic surgery on the face or breast augmentation. It helps prevent swelling, muscle fatigue, muscle soreness. It's a homeopathic medicine that's been around a long, long time. You take it under the tongue, it melts. There are also Arnica montana creams that can help with that muscle soreness that you might get initially when you first start a workout program. I hope this helps with some basic information for starting a fitness program. We'll be moving on to our next segment with a discussion on different types of options for fitness training. Today on the fitness portion of the show, we'll be discussing various types of equipment that you can utilize in your fitness training program as options. But once again, I always remind you, please consult with your physician and then use common sense when using these types of what I call tools in exercise. There's lots of choices, and depending on your various fitness level or on your disabilities that you might have, be it arthritis, there's lots of options available to you. One option that I see utilized a lot in the gym, particularly for seniors or those people who tend to have balance issues or who haven't worked out in a long time, is utilization of the ball. There are books, guides, this is just one of many, that you can get, and you can actually buy the ball to utilize to learn these exercises and then practice the ones that feel the best. You can use it for fitness training, or you can use it for strength training, all varieties in that regard. There are exercise bands which are inexpensive and available. You can get them at any good sporting goods store. And what they are basically, they're resistance bands, and you can use them for strength training, resistance training, basically bottom line, in different forms for biceps, for your shoulders. They're convenient. These can travel with you. If you take a nice vacation, they go right into the suitcase. And there are videotapes and other media forms, even going on the computer. You can get different programs that all the gurus of exercise bands have come out with. Simple resistance, good old-fashioned resistance exercises utilizing your own body sources, and there are books that you can get on that. Like, for example, for biceps, you can resist with your own strength and work your biceps. You can resist with your own strength and work your shoulders. Then there are the options, of course, of the gyms. We have a lot of local gyms that have various personal trainers that can work through programs with you that can make them very, very specific for whatever your needs are. But once again, consider what your various disabilities are, what your fitness level is, and go from there and make sure it is fun. Last comment. Surround yourself with those people who have the same ideals about being fit as you, and you'll have a much easier time in staying fit and a much easier time with having a lot of fun in doing what you're doing in your fitness training. So find a buddy if you can, go to the gym, whatever you can do to get somebody that walks that same talk you're walking, and that'll help you a lot. Hi, welcome to the research portion of our show. And with us today is Ralph Turchiano, and he'll be discussing the most current research within the past few weeks that's come about. Ralph?
Hi, thank you. Yeah, it seems like today most of our research is going to be primarily on vitamin D. In fact, most of our research is on vitamin D this week, it seems like. Vitamin D was recently studied in kidney patients, and basically people are going through dialysis and such things like that. They discovered those with the best levels of vitamin D and actually taking vitamin D supplements had a 26% reduction in death. In addition, after 2 years, those taking the vitamin D supplements had a 20% reduction in need for dialysis itself. And basically, that was a wonderful finding for kidney patients. In addition, another article came out on vitamin D, and this dealt with people who are a little older, usually 65 plus. They discovered through the Archives of General Psychiatry on May 8th, versus May 5th of this year, found that those with heavy depression, they had 19% lower vitamin D levels than those who did not. Now, I'm not saying people with lower vitamin D have heavy depression. It is those that have heavy depression all seem to correlate with low vitamin D levels. In addition, what they discovered, which was a little bit more disturbing, and those which are 65 or older, among men, 39% were clinically deficient in vitamin D. And ironically, among women, 57% were clinically deficient in vitamin D. And that was done with a study over 1,282 people. Now, for a little bit of a food warning. One of America's favorite foods is popcorn. Well, what would you do if you found out it wasn't too good, possibly even triggering an asthma in your kids or the lung disorders like emphysema? Well, there's a chemical in popcorn called diacetyl. It's a group of chemicals, I should say, that give popcorn its butter flavor. Well, a group of researchers in the issue of Toxicology Pathology basically were trying to sound the warnings on this chemical for quite some time. And the CDC has actually listed diacetyl, again, the chemical that gives popcorn its butter flavor, as an inhalation hazard. And you say, well, all right, I'll take that warning to heart. I just won't eat popcorn. They recently discovered even when you microwave popcorn in the workplace, there are high concentrations of this lung irritant found throughout the workplace itself. It's the vapors they discovered, and they said, quote, it is the diacetyl, it's vapors itself that can injure the lungs, not the consumption. Which leads me to my next ironic article. All right, well, the warning on popcorn, butter-flavored popcorn, came out, I think, the 28th of April of this year, which led to the damage control of the 1st of May of this year. The National Cancer Institute came out with an article basically stating about how the U.S. population's diet is not exactly up to par. They said that 83% of Americans get their vegetables from white bread, starches, and potatoes and ketchup. Only 10% consumed whole grains. Now here comes the ironic part, which I thought was kind of funny. Now remember, this study was presented by the National Institute of Health and also ConAgra, which is an agricultural company. Their answer was, eat more popcorn, which was interesting because as it came out in the study, it says people who eat popcorn have an approximately 250% higher daily intake of whole grains and a 22% higher daily intake of fiber than non-popcorn eaters, according to the Centers for Human Nutrition. Researchers used data from 1999 to 2002, and they surveyed Americans basically throughout the country, all throughout areas. In addition, to find out that only 10% of the Americans consumed even the recommended daily allowance of fiber. But again, that was their main recommendation. Their answer, of course, after that article was that eat more popcorn, it'll save America. All right, now for the updates. I like to speak more about vitamins. I always do. And sometimes I have to bring a lot of information about medications in that can be possibly hazardous. Even though I would love to be able to tell you more about that, my philosophy is when laying in the middle of the road, it is better to pull you out of the road before I start telling you the benefits of the sun. So, keeping that in mind, a lot of you heard the story about the incontinence drug out there and believing that it only affected people taking these medications that started developing what they call memory problems. Well, it wasn't just incontinence medications. It was blood pressure medications. It was antacids. It was asthma medications. All these drugs which tend to block a very important neurotransmitter called acetylcholine, the one chemical you may hear about that increasing the levels helps with the prevention of Alzheimer's. What they discovered was this. Basically just 1 year of use on these medications, they discovered the decline would represent a resident, for example, in a nursing home, going from requiring only limited assistance in an activity to being completely dependent, or from requiring only supervision to requiring extensive assistance in activity. That was 1 year's worth of use off of an antacid, off of a blood pressure medication, an incontinence medication, or asthma medication. That was it, not combined. But what they also discovered is that 40% of participants of those people in the study were on at least more than one type of this medication. If anybody taking what this class of drugs called antichlorogenic medications, you may want to really consider the risk-benefit ratio, which leads to my other favorite subject, behavior modification through chemistry. It is definitely a brave new world. Many of you may have heard about the anti-smoking drug called Chantix. Basically what it does, they found out, is if you take the medication for a 6-month period of time, it reduces your propensity to smoke by 33%. Meaning that 33% of the people who were taking the medication were not smoking after 6 months. But it also had another interesting side effect, psychosis. 43% of the individuals taking Chantix developed what they call psychiatric issues. Now, it should be fair. We can look at the positive side. That means 57% of the people who took the medication were okay. So it just depends on if you want to see the glass half full or half empty. Now, the interesting part about this medication, it goes into a class of drugs which is used for, of course, behavior modification in regards to addictions, whether it be food or something else. Well, when one drug fails, what do? You change your market. Well, they're taking the medication and they're going to market it to children. Studies suggest caution on a new anti-obesity drug in children. How do these drugs prevent addiction? They reduce your ability to feel pleasure. But also one interesting thing. So giving the drug to kids sounds interesting as far as reducing the pleasure in food. But it also stops the brain from developing itself. So keep that in mind. In the near future, you're probably going to find a lot of medical doctors or medical professionals want to recommend these new anti-obesity drugs to children. Fine, except one thing, outside the severe depression, chance of suicide, the brains won't develop. My answer to that is you take the board members of these companies and you make them do the trials on these drugs on themselves. Well, that's it. I'm done, and thank you.
Thank you very much for joining the Fit and Healthy Today show. We hope this show was both informative and will push you into looking to other alternatives to help you with fitness and research. Thank you.